Hello and welcome to Northern Nightmares. I'm your host Andrew, and oh boy, do I have some stories for you this week. I've been patiently waiting for us to arrive to this episode, and I'm beyond excited that we're finally here. We're going to be taking a deep dive into the world of medical sciences, more specifically procedures we used to do, but we stopped them as of how horrifying and barbaric they were. As you can see from the title, I present to you the world of lobotomies. Now, initially, this was going to be the only topic, but I figured, why not explore other practices as well? Now, to give you a little idea what to expect for this week's episode, do you remember back to the Black Plague episode? I discussed the art of bloodletting. That was where doctors would bleed patients in the hopes of driving any form of sickness out of them. Of course, this would only make things worse, if not killing the patient. Bloodletting isn't on this week's list, but I do have a lot of other heinous shit to cover. So let's get into the world of lobotomies. What is it? What was it supposed to do, and why? As well as more horrifying medical practices. Let's begin with our main course for today. Then we'll dive into some of the lesser known ones, as they're so barbaric. It's no wonder the world wants them forgotten. I'll mention some of these practices that go hand in hand with lobotomies over the time of this episode, and the rest of them I'll mention them at the end. So get ready, lay back and brace yourself, as I'm going to insert the pick of knowledge into you as we talk about lobotomies. And no gray matter will be removed during this week's episode, I promise. By the 1930s, mental hospitals were overflowing. Across North America and Europe, hundreds of thousands of people lived inside massive state-run asylums. Patients suffering from schizophrenia, severe depression, bipolar disorder, epilepsy, dementia, PTSD, or developmental disabilities were often housed together because doctors had few ways to distinguish or effectively treat many of these conditions. Many hospitals had originally been built with good intentions, to provide a peaceful environment where patients could recover. But by the 1930s, that vision had largely collapsed. Overcrowding, understaffing, and limited funding meant patients often spent years or even their entire lives inside locked wards. Treatment options were extremely limited. Doctors relied on methods that today seemed primitive or cruel, including prolonged restraint, heavy sedation, insulin coma therapies, electroconvulsive therapies, as well in its early form, hydrotherapy, and isolation rooms. While some treatments offered limited benefits for certain patients, many were experimental and carried significant risks. Families were often desperate. Psychiatric medications did not yet exist, and many patients experienced severe psychosis, violent outbursts, or profound depression with little hope of improvement. Hospitals became places of containment rather than recovery. It was in this environment where doctors were searching for anything that might calm severely ill patients and relieve overcrowded institutions that a radical new brain operation began attracting worldwide attention. This operation was the lobotomy. There was a time when lobotomies were considered the greatest thing for treating mental illness, and how wrong those doctors were. Lobotomies were created with the hope of curing many forms of mental illnesses. The procedure would involve cutting lobes off from the brain. First discovered in the 1930s by a Portuguese neurologist, Antonio Egas Moniz, first calling them Lobotomy. Antonio developed the first prefrontal lobotomy, which required drilling two small holes, often labeled burr holes, into the skull on either side of one's forehead. The drill that was used often was polished stainless steel, a material strong enough to withstand repeated sterilization. It was approximately between 8 to 12 inches long and resembled a small hand brace or carpenter's drill with a horizontal handle at the top. It also had a manual rotating crank to which the surgeon would apply a steady downward pressure until the patient's skull was thoroughly penetrated. Sorry, everyone, this is not the good kind of penetration we all love. Once the hole was created, a blunt knife or wire loop, which was called the Lobotomy, would be inserted into the hole and sever the white matter attached to the frontal lobe. Before we had psychiatric medications to help one deal with mental illnesses, it was thought that removing the connections between the frontal lobe and the deeper brain structures, it might interrupt the distressing thought patterns and overwhelming emotions. Between the 1930s and 40s, psychiatric hospitals were overcrowded. Many patients with serious illnesses had few treatment options beyond long-term institutionalization. Patients that received these burr holes were ones with severe depression, schizophrenia, obsessive-compulsive disorder, or OCD, chronic anxiety, catatonia, and even severe agitations or violent behaviors. Now, there were notable changes to a person after surgery. Some of them did seem calmer afterwards, but that was because we removed one of the most important parts of our brain. The connections between the prefrontal cortex and throughout the brain areas, they were severed and disrupted the brain's control center. This is responsible for one's abilities like planning, judgment, and overall what you consider your personality. There was also lifelong effects like loss of empathy, no more initiative, motivations went out the window, cognitive impairment, and even death could happen from surgical complications. After all of this, one should think, let's stop this immoral practice. Nope. Instead, let's improve it. Forget drills. Let's make it faster and less messy. So in 1945, an American neurologist named Walter Freeman, he dismissed the idea of using drills. Instead, he discovered driving an ice pick into one's eye socket to reach the gray matter for extraction was much easier. During this era, when a patient was suffering from mental illness, doctors would perform different types of psychosurgeries. When lobotomies became popular in America, Freeman learned the ways from Antonio by reading his papers. Basically, he got secondhand knowledge and decided he could make his own version of which was the ice pick. It was rebranded as lobotomies because in simple terms, it was done on the lower lobes of the brain. Now let's break down how the procedure went about. The patient would be laid flat down. Sometimes the surgeons would use a electroconvulsive therapy machine to deliver an electrical shock to the brain, rendering the patient unconscious for several minutes. Yeah, that's how we knocked people out before anesthesia, a shock to the head. The device looked like either two rods with soft material on the end or something looking like your standard over-the-ear headphones. Wires were attached and ran to a device that looked like a car battery that would send up to 70 to 450 volts of electricity to the patient. Funny thing is, ECT is still around, but I don't think it's like the good old days where one takes a blast of current to the brain. Now back to lobotomies. Once the patient received their shock to the skull, this would cause them to have a seizure and then render them unconscious. Then Freeman would take his ice pick and insert it under the upper eyelid and against the inner corner of the eye socket. The pick would rest on the thin bone, forming the roof of the orbit. Now, for the record, the eyeball itself was not pierced. However, the instrument did slid between the eye and the bone. The eye socket is made of very thin bone, only a few millimeters thick in some places. This allowed the pick to enter the cranial cavity after one used a mallet. Imagine taking a pick and going dink 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 with a pallet to reach the brain of some poor bastard. You would hammer onto the pick till it eventually broke through the orbital roof and entered the frontal part of the brain. The pick was about 5 to 7 centimeters long, and that's 2 to 3 inches in length. Now, as no holes were drilled and gray matter wasn't removed, the pick only disrupted connections to other parts of the brain. The pick would sever the nerve fibers in the frontal region. This ruined communication to the brain rather than destroying the lobe itself. This process still contributed to basic functions like planning, judgment, and etc., the stuff that I mentioned earlier. This whole operation lasted about 5 to 10 minutes. Freeman got so good that he managed to successfully remove the connections to at least 12 lobes on one person. He tried one time to remove up to 18, but managed to kill the patient, so he swept that on the rug and claimed 12 is the max. Once the procedure became popular in North America, you didn't need to be a certified doctor to drive a pick into someone's brain. Now let's look at the famous story I had found of one of Freeman's earlier patients. Ave Air was a 59-year-old bookkeeper in Washington, D.C. in 1936. She had spent much of her life functioning independently and holding steady employment. However, later in life, she developed a severe psychiatric illness. Records show she suffered from severe depression and extreme anxiety. She had obsessive and intrusive thoughts, like, for example, she was obsessed with how she looked, always making a point to look pretty when leaving the house. She was also found to be suddenly appear fully naked in her living room windows, flashing neighbors. She was also dealing with intense emotional distress, which made it very difficult for her to function normally, at least normal in the 30s time. But what is normal? I think it's better to be weird and strange. Fuck being normal. Now remember, during this time there was no such thing as antidepressants or antipsychotics or mood stabilizers or what we have today that we consider psychotherapy. Treatments were very limited to long-term institutionalization. Sedatives like barbarics, these were a class of central nervous system depression drugs that induced sedation, sleep, and seizure control, but carry high risk of addiction and overdose. There was also hydrotherapy, where patients were placed into baths or showers for an extended amount of time with warm water. It was considered to help insomnia and agitation. There was also, of course, shock therapy. Emma's mental illness was considered severe and resistant to the treatments that Freeman selected her as one of the first Americans to undergo this new operation. Freeman would also be accompanied with another neurosurgeon by the name of James Watts. Now, before he perfected his ice pick procedure, he performed Antonia's way by drilling holes into her skull. They inserted their ice pick into the holes to sever the nerves. This was before he started to shove it into the eye socket. He cut away the connections and then he sewed everything back up. According to Freeman, her depression became less severe, anxiety decreased, and she became notably calmer. She regained the ability to function independently and she returned to her bookkeeping job. However, there were side effects that made a dramatic change in her personality. These side effects were common among a lot of patients after getting their brain matter scooped out or picked at. They suffered from bluntly expressing their emotions, loss of initiative to do anything, had difficulty making decisions or even planning out things. Basically became a shell of what they used to be. Mind you, she was at peace, but lost all her will to do anything else. For example, there was no drive to go to work. She had to be reminded that it was even a thing. This was the after effects of lobotomies. You basically had inner peace. You looked at all your problems through a porthole, and that was it. These procedures were thought not as a way of curing mental illness, but to cut away the soul of a person. Everything you ever were was cut away, leaving you as a doopy, smiling person, like a robot. Some other famous cases of lobotomies included Rosemary Kennedy, sister of U.S. President John F. Kennedy. She underwent the surgery on 1941. It left her incapacitated and left to grow old and die in an institution for the rest of her life. Howard Doley was an American memorist. He was known for being one of the youngest survivors of a lobotomy. It was done on him when he was only 12 years old. Even Tennessee Williams' sister, Rose, had a lobotomy, and it left her in the same state as Rosemary Kennedy. After the 50s, though, lobotomy started to see a decline because psychiatric medication started to appear on the scene. There was also a growing awareness of procedures and the side effects, public scrutiny, media reports, and advocacy by former patients and families. Oh yeah, and the media was eating this shit up. They were the ones that were blasting it when it was popular, and then destroying it when the tables had turned. It wasn't until the 70s that lobotomies were finally shut down for good, and since there were so much safer treatments on the rise, I would say though that there are people out there that don't have mental illnesses, and I think a good lobotomy could fix them. And I'm talking about shitty people, that is. I'm joking though. Can you imagine though just living life full of peace, not giving a shit about what's going on in the world? Especially now. I think I could go for some inner peace, minus the ice pick going into my skull. Now, while lobotomies remain one of the most infamous symbols of psychiatry's darkest era, they are far from the only disturbing treatment used during the 30s. Across mental hospitals and institutions, doctors experiment with a range of extreme procedures, many of them painful, dangerous, and based on little scientific evidence. From insulin-induced comas to electroconvulsive therapy in its earlier form, these treatments reflected a time when desperation often outweighed understanding, leaving countless patients to endure procedures that would be considered unthinkable today. Now, let's look at some of the other procedures that were stopped because of how barbaric they were. I mentioned a few of them in the beginning, but let's look at them in greater details. During the 1920s to the 60s, there was one called insulin coma therapies. Doctors would inject patients that were suffering from schizophrenia with massive doses of insulin. The insulin would lower the blood sugar so dramatically that a patient would sweat profusely, shake uncontrollably, lose consciousness, and enter a coma. Doctors would then wait 15 minutes to an hour before reviving them with concentrated glucose. This would happen to a patient 5 times a week for at least several months. A patient could be placed into 40 to 60 comas in that time span. It was believed that this shocked the brain into a reset so it could fix their schizophrenia. They were treating people like our phones, giving them the old factory reset and hope that fixes the problem. You can't just unplug a person and plug them back in and think, that should work. The problem with this was that there was very little scientific evidence. All it would do is cause permanent brain damage, seizures, heart failure, and even death. Remember when I mentioned the shock therapy? Well, before that, there was metrazole convulsive therapy, which only lasted several years between 1930 to the 40s. Before the shock therapy to the skull, doctors would inject patients with the drug metrazole that would cause violent seizures. The goal was to reset the brain as well, and not just to fix schizophrenia, but all kinds of mental illness. However, what would happen would be that the patient would just experience extreme panic, terror, and violent convulsing seizures. Many patients suffered broken bones like the back, shoulders, jaws, and even torn muscles. Once ECT was available, this method was quickly abandoned and swept under the rug. One of the longest treatments that was used in this era was the hydrotherapy. Patients would lay in warm water between 8 to 24 hours, sometimes several days. Some places even left a patient in a tub for weeks on end. It was thought that warm or cool water could be applied to the skin to induce various reactions throughout the body. Warm baths would be used to treat patients with insomnia, suicidal behaviors, and agitation. Cold baths were used for manic depression issues, slowing down blood flow to the brain and decreasing mental and physical activity. Canvases were used to cover up the patient with just their head sticking out, preventing them from getting out. Obviously, this didn't work, considering that it was inhumane. But there was also some bizarre ones that just don't make sense. There was one called rotational therapy. Patients would be strapped to a rotating chair and spun at fast speeds. It was believed the spinning would affect blood flow to the brain and the nervous system. All this caused was vomiting, dizziness, and disorientation and exhaustion. There was also carbon monoxide therapy, where one was forced to inhale high concentrations of CO2. It only caused air hunger, panic, and unconsciousness. It was quickly abandoned, though, because, it might not be good for you. You could die from it. Not every treatment was heinous, though. There was one called occupational therapy, where doctors instructed patients to perform manual labor like farming, gardening, sewing, carpentry, laundry work, and even baking. This would be actually successful, as it helped build routine skills. However, it does eventually cross into the unpaid institutional labor and had to be quickly shut down. Yeah, doctors had basically made slaves out of mentally ill patients. Great job. One misconception, though, is that all these treatments were simply acts of cruelty. In reality, many physicians generally believed that they were helping patients. Psychiatry had very few effective treatments before the 1950s, and severe conditions such as schizophrenia, catatonia, and bipolar disorder often left people institutionalized for years. That context doesn't excuse the harm they cause, but it does help explain why risky and invasive procedures gained acceptance. As evidence accumulated and new medications became available, many of these practices were abandoned or fundamentally changed. Regardless of what they believed, this shit was horrible, and I'm glad they don't do it no more. I'm not saying some of the stuff the medical world does now is any better, but that's a story for another day. I really enjoyed diving into the medical world for this week's episode, and this gave me some more ideas for future episodes like this. If you have any stories like this or others that you want me to talk about, feel free to email me at northernnightmares@outlook.com. Don't forget to follow me on Instagram, where I post all the latest news and updates about the show. Follow me wherever you listen to your podcasts. And as for next week, we'll be heading into Toronto, Ontario for one serial killer story I'm sure you've never heard of. This is your home for nightmares, tales throughout Canada and beyond. I'll see you soon. Sweet dreams, and remember, nightmares are closer than you think.